And then we are starting out this morning with Dr. Brent Wallis, who we've talked to. He's the Chief Medical Officer of People's Health many times. And Donnie Miller will join us, the CEO of the Ascension Parish Chamber of Commerce. I know they're very excited, Doc, about you guys having this facility here in Gonzales. And welcome to the show.
Yeah, thank you, Newell. It's great to have y'all back here again. We've done this quite a few times now, and we're very excited about this Gonzales opening. This is a really great facility.
You know, the interesting thing about this area, and I think important to y'all, is that this is a growing area of the metropolitan area of Baton Rouge, right? In fact, it's one of the fastest growing areas, if my memory serves me correct, south of Baton Rouge, which is huge because that creates more demand, and we know that there's been limited supply of primary health.
Yeah, absolutely. You know, Ascension Parish is growing at an incredible rate, and you're absolutely right. It's a demand, but it's really a need, I think, for this population. As more people move into this area, more industries coming to this area, there really are not enough healthcare providers to take care of them. And we saw this area about a year or so ago and started thinking about it and really thought it was a great opportunity to provide our kind of unique form of medicine to this location.
And you guys now have 12, and I've been fortunate to open a number of these, and I got to tell you, your staff at each and every one of y'all like clone your staff. I mean, they're all smiling, they're happy. They're amazing people. I got an opportunity to spend about a half hour with some this morning, just chatting about working here and living in Gonzales. They're very excited about it. They love Gonzales, which is great. But that's been my experience at every location.
Yeah, exactly. Some of the people here have actually worked in other primary care plus clinics, and when we opened, they were excited to move closer to home. But yeah, I can't quite believe it's 12. I think you've been here for about a half dozen of them, and continuing on. It really has been fantastic growth for the system, and what I'm most excited about is, again, it's kind of an alternative place to seek care, and we really are proud of what we do. Our people are fantastic. You're right. For us, this is like a family reunion. We get together every 6 months or so at one of these grand openings, and we all get to hug and eat a little together.
We were supposed to open this facility about a month and a half ago, if my memory serves me correct. The weather that day was atrocious, and as smart people do, y'all canceled it.
We did, said,
This is not going to happen. We'll just do it a little bit later. No big deal. It was good. But, this morning, and the point I'm trying to get to, so y'all have been in operation for a little while now. And I always love when the patients walk in and they know everyone's first name.
Oh, yeah.
And they literally hugging the staff here.
It is. I mean, it really is family, and I think all the people that come here really appreciate that care they're getting, but they really do know you. I mean, it is a first-name basis. When we pick up the phone, usually we know who they are right away, even before they tell us who they are.
Right.
And that's kind of the point of this. It really is, kind of an older style of medicine where
Marcus Welby, MD.
Yeah,
right?
They really get to know you. And
now, the younger crowd have no idea who Marcus Welby, MD is.
I do. Unfortunately, I do. Yeah, and I think when you meet Dr. Sayes later, you're going to see he's a really fantastic physician, trained at Tulane, so he's a local guy, but doesn't live too far from here. He was very excited when we reached out to him, and a great addition to our medical staff.
Yeah, and that's kind of the key, right? I mean, the uncertainty, the anxiety of healthcare, the challenges that people are facing is to go someplace that's warm, friendly, receptive.
Yeah.
You don't feel like you're having to chase the medicine, right?
Yeah, exactly. And I think having that access is something that's really critical. You shouldn't have to go get health care wherever they happen to be able to see you. You should be able to come to the person that you've established a relationship with, and that's really kind of the hallmark of primary care. We should get to know you and understand what your needs are, kind of anticipate those things, and really that's what Mark is here to do for this community.
And we've talked previously about really this model and what sets it apart from a lot of others. And I think the key ingredient here, and what I hear, because almost every opportunity that I've had, I've been able to talk to patients as well, right?
Mm-hmm.
Is the time spent with the patient.
Yeah, and
they feel like they're not going through this, mill where it's just like bing, 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 and out of the door.
Yeah, exactly. You shouldn't feel like a number when you go to see your doctor. It's, this is not getting your oil changed. Medicine requires tough conversations and sometimes longer conversations to kind of tease out what's going on. And what is really nice, here our physicians don't see all that many patients in a day. A lot of them will top out at 10 patients or so in a day, but they need that time to really get to know the person, get to know their family, and really kind of create a plan for you, understand what your desires and needs are, and that takes time,
What I've heard from patients in previous openings, too, and it comes up every time without exception, is the ability of the staff to help navigate when they have to see a specialist or go somewhere else, whether it be diagnostic services or whatever it may be, which increases the angst, increases the anxiety. You go in someplace you've never been before, and they all say, huge help. I mean, just make it real easy, short of sending them dropping a pin on where they have to go, right?
Yeah, I mean, it is so complex in our medical system right now. And what we're really good at is primary care. That's what we do here. We're not trying to cover all the specialties and all the other things you need. So we have created a lot of relationships in this community and others where we've got ways of getting you in to see who you need to see right away, making sure you understand where you're going, what to expect, what the expectations are. And then we reach out to those providers and actually have a conversation after to find out what they told you, so that when you come back in to see us, we can reiterate and reinforce what that plan is from the specialist. And hopefully that navigation, which is what we call it, and it involves every level of the clinic, everybody on the team trying to help out. That navigation can hopefully result in really better, high-quality outcomes for the patient.
Well, there's no doubt. I mean, if you were to ask me, what did the doctor tell you the last time you visited him 6 weeks ago? I can't remember yesterday sometimes.
Yes, sometimes I know.
And I'm not the best scribe, so to speak, where I'm sitting there writing it all down, right? Most people are not, right?
No, and I think, too, a lot of times when you come to the doctor, you've got a lot of things going on. You may have a really severe illness, and so you're not super focused on all the details. And so we try to eliminate all of those barriers for you. One group we have that's fantastic, our care managers, our RN nurses, will actually reach back out to you sometimes after appointments, especially when something has happened, and really kind of check in on you, make sure that you understand what's going on. Did you get your medicines? All of those things. It's a part of that navigation program.
The other thing I have heard, and I'm sure I'll hear again today, is the management of medicine.
Exactly.
All of a sudden, and I speak personally, I went from one bottle to, I think I'm at 6 now, or 5. I'm not exactly sure.
It goes up exponentially.
Sometimes, and as I get, each year passes, and then it's like, okay, what was this one for again? What's that one for? You read the label. The labels are not much help at all.
I know. Well, and they make them so small, too.
That's
the other problem. Yeah, I mean, medication reconciliation is critical. And I'll tell you, one of the things that we're very big on, too, is something called polypharmacy. Mm-hmm. It's where over time, meds get added and added and added, and sometimes you may not need all of them. And so we spend a good portion of each visit looking at your medications and trying to decide, maybe you're on this one because this original one caused a problem. Well, if we eliminate both and put you on something new, that could be better for you. So, and that really, simplification is one of the tenets that we really live by here.
Well, congratulations again. The number of patients that y'all are seeing are up. The number of locations are up. Y'all are providing a vital service to each and every one of these communities. Obviously, the momentum is strong. I think y'all are also thinking about some additional locations in 2025.
Yeah.
And would love to be there for you because I've always had a lot of fun at each and every one of these openings. If you want more information, folks, you can go to primarycareplus.com or you can give them a call at 1-800-978-9371. Set up your appointment, get acclimated to Primary Care Plus. You'll love Dr. Brent Wallis. We all do. He always makes himself available if there's something trending out there that we need to find out about. Doc, thank you so much for joining us this morning.
Yeah, thank you very much for coming. You'll definitely get an invite to the next one.
Thank you, sir. We will be right back with Donnie Miller, CEO of the Ascension Parish Chamber of Commerce, when we return.